main output. This is OPD, where we do outpatient department.
The requirements of these days is about 35 faculty, but our OPD is so high that we have to hire a lot of other consultants to come.
We planned it in a manner, the picture is clinical rights. I love the colors are really good, very soothing colors.
We have our own
Yes, sir.
Please.
Yes.
Okay. Try to make one unit and one clinic of itself.
Yeah.
This is a dissection.
And I new stuff.
Hi, nice to meet you.
That's our doctor.
Nice to meet you.
So these people have been working hard to produce about 150 benches a month. And library block that we have done. It's a good.
Yes. Okay.
Okay. You ready?
Yes, sir.
Start naming libraries and research centers after you.
Yeah.
System enough in the school and that's it. Even more green sharing room. And
Private
then
dash.
Yeah.
toilet.
Dr. Ashish Jain, my dear dentist friends and my dear students. Today it's a great pleasure to welcome you at Karnataka School of Dentistry. I am proud to inform you that our college has been given research center in collaboration with Goldman School of Dental Medicine, Boston University.
The existing building, and this is how it will look like once we complete the campus. So this is a spread over 20-acre of land, located 6 kilometers away from the Gandhinagar, and 23 kilometers from Hyderabad.
Now our students will welcome our dignitaries. Verena will welcome Dr. Van Dyke and Dr. Kilgore on behalf of our honorable chairman.
Madam Principal, Mr. Chairman, faculty, students. It's really an honor to be here. I bring you welcome from our Dean, who's same as Principal, from Boston University, Dean Spencer Frankel. He brings his best wishes. You truly have an outstanding, beautifully done school. There's obviously been a tremendous amount of thought and work put into not only the design of the building, but the functionality of the building. The space that you have makes Dr. Van Dyke and I very, very jealous. You have lots of space.
Well, thank you. I want to also bring my greetings. Of course, Dr. Kilgore takes all the good material before I come up here. So rather than waste your time with more platitudes, I just want to welcome everybody. I want to congratulate you again on what a fabulous job you've done here, and say that I'm really looking forward to working with you in the future. So thank you.
We would like to brief you about the historic day today in the life of Karnavati School of Dentistry. I'm Dr. Ashish Jain. I'm here as the Country Director for Boston University. We are here to tie up with the Boston University and the Karnavati School of Dentistry, and we are talking of tie-up at two levels. One is we are opening up a clinical research center, and the other level is we are launching our postdoctoral CE programs today.
Who are coming here for the first time have liked our campus. I'd like to introduce you to our guest, Mr. Mittal. He is the chairman of the board. Dr. Kilgore and Dr. Van Dyke. They are professors from Boston University. And we are very happy to announce that we have inaugurated a clinical research center, and our library got inaugurated today by the doctors. And we have tied up with Boston University for clinical research center and CE, that is continuing education program.
Ways and ways of detecting oral cancer that can be brought into the community. So one of the real areas of foresight that the school has is to have the vans so that you can go out into the community and bring the dentistry to the community. And it's not as easy doing surgical procedures, but with this particular procedure, it's a brush that can brush tissue, suspected tissue, without having to need local anesthetic or sutures after the procedure. And then it's sent to a special laboratory which detects certain cell changes in the cells that you brush. And then the important thing about this is that it's not a perfectly diagnostic system. If the test is positive, then you do have to go ahead and do a biopsy to make a definite diagnosis, but it certainly assists the practitioners in doing that. One of the things that we stress, and I know is stressed in the schools here, is that oral cancer
thanks to Mr. Thomas Van Dyke, Mr. Kilgore, thanks to Mr. Jain, who managed all the show, Mr. Khanna, our friend Mr. Rohit Jain, Mr. Gupta, our friend Mr. Swami, Dr. Indersen, and all of you who spare time to come to here. Thank you very much.
Dr. Van Dyke will deliver the speech.
Good, thank you very much. Again, a pleasure to be here. It's nice to see a room full of students. She has no cervical or submandibular lymphadenopathy. She has no signs of TMD, or reports of muscle pain. Upon intraoral examination, if we look at the maxillary arch, what we can see is that she has quite a bit of gingivitis. You can see frank swelling and inflammation associated with these crowns. You can see that the crowns are poorly contoured, and she has a temporary restoration here. And she's got basically multiple fixed restorations. What I'm going to do is walk you through the arches sextant by sextant. We'll start out with the maxillary right sextant. For those of you in India who use a different numbering system than I do in the United States, the way we don't do it by quadrant, we just start with the upper right first molar, that's tooth number 1, and we go to number 16, drop down to the lower with 17, and end up with the lower right third molar being number 32. Okay, so she's missing teeth number 1, 3, and 5, and she has a fixed partial denture from 2 to 6, including tooth number 4. If we look at the radiograph, we can see that she has endodontic therapy on number 4, and she has an open margin on that crown and recurrent caries. If we look at the maxillary anterior sextant, what we can see is frank inflammation of the papillary areas with gingival swelling. She's missing tooth number 9, which is a pontic in the fixed bridge from 7 to 10. And she has open margins on both line drawn from the cuspid to cuspid. And if that is level, the central incisor gingival margin should be on that line, and the laterals should be slightly off that line. So what we can see is there's a huge gingival line discrepancy between 8 and number 9.
I feel like I'm repeating this lecture for those of you and faculty and students who were upstairs for the press briefing. We did talk a little bit about this particular problem, and I think that the main thing that I would like to point out is that as opposed to some other forms of cancer where we collectively in the medical field have been able to reduce the incidence and the death rate and the mortality rate of cancer through early detection with things like chest x-rays, mammograms, PSAs for prostate cancer. In the area of cancer of the mouth, the survival rate of 50% hasn't changed in the last 50 years. And that's a problem. And it again is a problem of early detection. And as I mentioned, and I tried to stress with the folks from the press, is that it is really our responsibility, and to a certain extent the patient's responsibility, to have periodic oral examinations, but certainly our responsibility as practitioners to do a thorough examination of the mouth every time we see the patient. I think that, you know, typically what happens is they come through oral diagnosis and you do a thorough examination and you record your findings and you do your treatment plan, and the next time they come in for a crown preparation, you know, you tend to focus right in on the crown preparation and not look around the full mouth. So I think that's my, probably, if any message comes out of this, it's early detection through a comprehensive oral examination every time you see the patient. And again, trying to get the patients into the door, and if not, then early detection through screening processes. Own kind of scientific thought, you know, what else is, what are the other possibilities as far as developing early detection of oral cancer? To conclude, I just want to thank you all. You've been real patient. I know it's been a long day for you guys as much as it has been for us. And again, I'd like to thank you very much for having us. Thank you. Are there any questions that I can answer briefly? Okay, thanks again.
जिंदगी दे बैर होना किसी का किसी से भावना मन में बदलेगी होना कर दे पावन हर एक मन का कोना हम चले नेक रास्ते पे हमसे
रही है मुश्किल